Hello, I'm Dr. Brzezinski, and I'm really excited to be guiding you through this course. I think we have to start in this module at the very basics. And I think what we're talking about in this course is really the heart of supporting students verified on the autism spectrum and diagnosed on the autism spectrum. So what we really need to do is talk about how do we support them, because we can assess and we can identify that there are needs, but the connection is really with the intervention and the treatment planning that we actually put in place. If you move past this program and you become an autism specialist, or you become a coordinator in an area for a BOCES, or you become a coordinator just in general within your building, or you become a lead teacher in that, you would need to guide others through this process. So what you're going to find in this course is that we are going to talk a lot from the perspective of you guiding other individuals in identifying the intervention strategies and best supports for treatment planning for students with communication and social needs within the autism spectrum. And so in this particular module, I wanted to take a few minutes. You can read more information about the assessments and the connection of assessments to the interventions and treatment plans, but I wanted to take a couple minutes to give you some more information beyond the textbook. And so one of the things that you're going to find is most of this information comes from the Prelock and Macaulay text. And you can find more in there, and I will refer to it throughout. You have two really good texts for this course. And the Prelock and Macaulay has the strongest component, I believe, about the assessment. Now, we will have some assessment for assistive technology, which will come through the Gantz and Simpson book, but I wanted you to know the main heart of how we plan. So the key thing that I believe in, regardless of categorical determination, regardless of what the student's grades are, regardless of anything, is that assessment should always guide our planning decisions. And that's what we'll come at from this class, is that we will make sure that, number one, that assessment is used to define the purpose and the goal of the assessment, the planning, and the treatment. And so everything is coordinated, everything connects, and that's one of the key factors that we will make sure. Now, we will identify the factors also in impacting selection of your intervention. So we will look at different assessments and what information they give and how to really examine those. And in this module below, you will see that you can explore several different assessments. Your book also has an amazing table that is going to help you with that process as well. And then a third component that we have is that treatment planning and progress versus standardized initial verification. So there are a lot of reports that you will be able to access for students who are already qualified. However, what you need to do is identify more elements for treatment. Those might be informal checklists, those might be other components. And that helps us really go beyond that initial verification. Those standardized assessments are amazing at giving us some information, but for treatment planning purposes and intervention planning purposes, we have to make sure that we go beyond just that initial assessment. And that's what we talked about, is to define the purpose. Now, when we are selecting an assessment, we have to think of, what do we really need to know? And so we ask ourselves what we need to know. What is the area of difficulty that we are really trying to assess? What are we seeking to find in this process? And what are the student's strengths, abilities, and interests? And so one of the things that I wanted to take you back, I always kind of do this little Wayne's World thing, is to go back to the zone of proximal development. It's one of the early components that you probably learned about in your education, I guess. It's a theoretical concept brought forward by Len Vygotsky. So we want to remember that we have to look at what our learner can do right now. We have to not assess that component, We are going to look at what the learner can do with assistance and what the learner can do with some support at all, or they cannot do it all. And so when they have that strength, we're going to use that in our determination of our intervention planning, but we are not going to assess for that component because that's a strength and that learner can do it alone. So if you look at your zone of proximal development, because I know it was probably a long time ago that you may have had this instructional component, but you have to think of that middle ground of what can the learner do by themselves? What can they already do? Because we don't need to support them in that, because if we support them in that, we might enable them. So we want to make sure that we are only looking at those two outer circles when we are defining our purpose for assessment, so that the learner can do with assistance. So what types of assistive technology? That's assistance. If the learner has the skill, but the assistive technology is going to give that information out, what can we do? So that is the critical component where we want to know what supports do we need, or if the learner really with a fidget can be able to attend in class, that's what the learner can do with assistance. And then we look at that outer component of the tasks that the learner cannot do even with assistance. And so I want you to think about that in the terms of students with more significant disabilities. If a student is nonverbal, or a student has physical limitations, those are the things that the student cannot even do with assistance at this moment. That doesn't mean that our assessment isn't going to put a treatment plan in place that we can actually get them to the task that the learner can do with assistance. Those are the components that they cannot do now. That is what we want to assess. We want to assess the elements around that. So for example, if we have a nonverbal student, our purpose really is to look at assessing the communication realm so that we know exactly what they can do and can't do, because there may be things they can do, but they can't express that to us. And so we have to define that purpose. And once we define our purpose, we have to think about the factors that we will use to select assessment. So we have to think about the severity, as I gave in that last example. If a student maybe just struggles with the interaction with peers, that is different than a student who maybe has zero verbal skills. And so we want to think about the severity of the disability. We want to think about, are there communication methods and needs within this? Do they not understand social cues? Is there a cognitive component that isn't there? A lot of times we may get a cognitive assessment. I know in certain states they don't do cognitive assessments. However, we do them in our state, but you may not have them, but you may need to know where they're at. You may want to do further informational assessments. It's, even though they're standardized, that might be appropriate for the severity of a disability. You might ask the speech path to come in and do some standardized assessments. And now if it's just the social element, we might do a social skills or a social cues checklist. And so we think about how that severity of disability will help make our decision as to what assessment we will be using to drive our treatment plan. And so then we have to think of the area of impact. Is it impacting the language domains? Is it impacting behaviors? We really want to think about, where are we going with this? Because if it's the language domains, we may look more towards the communication component. If it's behaviors, as in social behaviors, we might do social behavioral informational checklists or assessments. We also might do social communication. And so we want to think about, where is that impact? Where is that, if you think of that, if I go back, where is the disconnect between this realm and this realm? What is going to take a learner for something they can't do to something they can do with assistance? So think about what assessment will give you the information to know exactly what to use for that component. Then we have to think of age and developmental stages, because not every assessment is perfect for every student. So for our young students, if they're pre-linguistic and they're maybe preschool age, or they're second, third grade, 2 or 3 years old, we might have to use different assessments, because they're not going to sit there and answer questions on a checklist. And so if they're nonverbal, they may not answer questions on a checklist. We may have to adjust and adapt that assessment, or we may have to look at, if they're a transition age student, using a picture employment assessment rather than a COPS-based assessment, which is pictures, but it also has to have very significant understanding of the scoring components that they have to identify. The picture-based assessment, like the PICS, is easier. So it's just pictures. They don't have to understand or comprehend that language. So you have to think about, where are they at with their linguistic level? And then if they're in the beginning language phases, we have to keep those choices simple. Remember, students should have a part in their assessment. So the reason that we're looking at the age and the developmental stages, and we're not just conducting parent assessments or teacher assessments, is because our students should always have a voice. Regardless of the severity of the disability, there is always a way for them to have a voice. And then we have to look at the functional and life developmental stages, because if our student, they may be a transition age student, and maybe they're going to be working on the language of work, and we know that we need to know exactly some transition components, but we're not going to do some of the more advanced. We wouldn't do the post-secondary attending of college assessments, those kind of things. So we want to make sure that it matches the functional life components. And so once we identify our severity of disability, our area of impact, and our age and developmental stages, we can then make a good decision about what assessment is going to support our purpose. And then we have a couple of other considerations that we have to think about. Different methods must be used for planning treatment and for monitoring progress. And so always remember, I think a lot of people think when they're talking about picking assessment, or they're picking those kind of things, we have to think about what that is. It should be sensitive to change, and it should adjust to specific behaviors. And so we want to remember that we need to pick assessments that are not going to give us just basic overview initial diagnoses. So we may have an expressive and a receptive language assessment that was done as a part of the initial assessment. That gives us some information, but it doesn't give us information that it can be used for progress monitoring, because we're not going to go back and consistently give that. We know the rules of standardized assessments, and it doesn't work that way. So what we want to do is we want to think about what is sensitive to change. What can I do to catch if progress is being made? It isn't enough just to set a goal of student will complete, 10 of 10 verbal cues 100% of the time, because that's not telling us what the growth is. The growth is more detailed. If a student is giving 1-syllable words versus 5-syllable words, we want assessments that will be sensitive to the change and the growth and being able to show that progress, rather than being able to just demonstrate to us, yes or no, the student can do it. This is where they are in relation to their peers. It is more individualized, and it is focused on the student's individual needs. It also should be based on specific behaviors. So a lot of times in an initial communication or in an initial diagnosis, what we would have is we would have general behaviors. We wouldn't get into the deep detail of the behaviors. We wouldn't be doing a functional behavior assessment and digging really, really deep into those behaviors, or making sure that we're changing and we're adjusting. And so we want to think about our time on task may change. Yes, I may use it in an initial qualification. However, I would adjust the components that I'm actually measuring. And so we think about those specific nuances and the differences between if we're using an assessment for planning treatment and monitoring progress, or if we're using it for an initial communication diagnosis. And we always have to remember when we are assessing reliability and validity, both measures of reliability and validity should be specific to the purpose of your assessment. They have to be reliable based on that, and they have to be valid based on that. We cannot just say, oh, well, this was proven reliable or valid, so therefore I can use it. We have to think about, my purpose was to measure the social communication level of my student and the specific skills that they do have, so that I know what to support and treatment plan for building what maybe we need in that zone of proximal development to get them to what they can do with support, and then to get them to what they can do independently. So if that's our purpose, we may have a reliable and a valid assessment that measures sensory components for students verified on the spectrum. It may be reliable and valid in the sense of the way that the test was put forward. But for our purposes of assessing social communication with peers, it is not reliable or valid, because the information that we get will not assist us in treatment planning and intervention planning. It has to be specific. It cannot be a one-size-fits-all type of assessment. We also have 4 additional characteristics that we need to be mindful of. We need to make sure that we have interdisciplinary components in there. That means that if we are looking at social communication with peers, we need to look across just our world. We need to look at speech. We maybe need to look at sensory components. Maybe we need to look at assistive technology assessment. Maybe we need to look at home and ecological assessment. And so we have to think about all of the disciplines and how it can impact the student. Then we want this to be comprehensive. We need our assessment to be comprehensive, to give us specific information. We may need for social communication with peers. We may need home information. We may need to evaluate how they do in Boy Scouts or Girl Scouts, or how they do in their classroom. We need to look at all aspects and the impact of the autism spectrum disorder on that specific component and that purpose. The purpose drives everything. We need to be culturally informed. We need to make sure that we are choosing assessments that will gather the information we need in a culturally respectful manner. We need to make sure that social communication with peers is looked at from a cultural perspective. We need to make sure that sensory components, we may work on something in school and assess a component, but maybe it's not acceptable in the child's cultural norm. We need to really think about what we are doing and how we're assessing. We need to make sure that we're not giving them a list of words that they could possibly not know given cultural components. So we need to really look at, is this going to be specific for our student? And finally, we need to look at family-centered assessment. A lot of times we don't gather a great deal of information. However, it is vital to our treatment planning and our intervention decisions. Number one, because families have their children and they've had them for so long, they know better. They know them better. Now, a second component is that really we need to get that wraparound support, and we need to make sure, especially for students who are diagnosed with autism spectrum disorder, that consistency is there. And if we're going to be doing something in the school setting, we want to work together with home. So the assessment needs to be family-centered. The parents need to have a voice. They need to give information to it. A lot of times these informal assessments are checklists, and we need to make sure that parents have the opportunity to complete them as well. Once we consider all of those components, and we have, and I'll go back just to review, defined our purpose, we've looked at the factors affecting that and connected it to our purpose, and then made sure that we considered that this is for treatment planning, interventions, and progress monitoring versus an initial diagnosis. We check the reliability and validity to make sure it's going to give us the information we need in order to plan that treatment. And we look at those 4 additional characteristics. We're ready to plan. And so in this course, our whole focus is going to be using strategies for treatment planning. We are going to look at traditional behavioral interventions. We are going to look at social pragmatic developmental interventions, and we're going to look at contemporary behavioral interventions. We're going to connect all of these things together, identify several methods and different programs that you might possibly use, or different strategies that you might use in your practice in supporting students verified on the autism spectrum disorder. But the biggest thing we have to remember is they have to be evidence-based. That is one of the key reasons that I chose the text that I did, especially the Prelock and McCulley, because they have a list, and you're going to see that on page 30 to 33 of all of the components that you are going to be learning. In this course, you are going to be able to connect assessment to the interventions. Each intervention is noted in a chapter number. So the way that page 30 and 33 are set up, and I really would like you to review these for this particular module, is you will look at the chapter number, and then you will look at the chapter title. The chapter title has a focus of what the interventions and strategies are that you will be learning. You will learn several of them in this course. The next column over will tell you the purpose. And this is where, remember, you had to identify that consideration of, is it for treatment planning or initial? So you will see that it's either progress monitoring or treatment planning. And so you want to think about those components there. And then they connect assessment measures, which identify selection of the intervention and can be used for progress monitoring. So really, this text brings it all together in one nice table. And so I really would like you, after this video, to take a good 5 to 10 minutes, review the structure of that table, but also look at those assessments. You're going to see underneath this in the Canvas course, there are actually buttons that will guide you to look at these assessments and to explore them. Take a good amount of time to explore those assessments. That way you understand, as we go through in the next chapters, we're going to be talking about the components that exist. And if students cannot do things by themselves, how are we supporting them? And so we are going to go through this entire process in module 2 through 6 about planning for interventions based on the assessments. Thank you for joining me for this quick module 1 overview and lecture. I look forward to supporting you in this course, and I hope you have a great week.